Hey, I'm Dr. Jay Calvert, and I just want to talk to you a little bit about coronavirus. I've been getting a lot of direct messages and a lot of emails through my website about what should I do if I want to prevent this virus, or what do I do if I get it? And I'm a plastic surgeon. I'm not an infectious disease specialist, but I do know a lot about taking care of patients. I take care of surgical patients all the time that have lots of different health issues. And I can talk to you about what I have recommended for my family and my staff and the people around me who I care about, how to take care of this. And so what's important to understand is that coronavirus is different from the flu virus. Everyone says, oh, it's like the flu. Well, it's not. It's like the flu in how it's transmitted. It's like the flu in a lot of the symptoms that you get, although it seems to be more respiratory based. Flu has a different sort of thumbprint, if you will, in terms of how it presents. But the difference with coronavirus is that it is much more deadly than the flu. The flu is definitely deadly. Most people don't realize that somewhere between 15,000 and 60,000 people a year die in the United States because of the flu. Well, the coronavirus has a higher percentage of deaths for the people that are infected. Now, who is it deadly for? Well, if you're healthy and you have a strong immune system and you eat well and take care of yourself, well, then the coronavirus probably isn't going to be lethal for you. But if you have multiple medical problems, or you're on chemotherapy, or you're on any medications that weaken your immune system, say some of the rheumatoid arthritis medications, anything that would cause your immune system to be less than stellar, well, then coronavirus is a bad thing. And these are the people that I think are much more at risk than the general public. Now, can you still die from coronavirus if you get it and you're healthy otherwise? Yes, that's for sure. And this is why the CDC and the rest of the world really is taking such extreme measures, because they don't want to have a huge pandemic of millions of infected people. So a lot of people wonder if the masks are really useful. The truth is that the CDC and the World Health Organization are not recommending masks right now. Should you wear one? Why not? If you want to, great. If you have one, wear it. But I will tell you this, if you don't cover your eyes and you don't seal off your eyes, you're going to be exposed to the respiratory droplets just the same, because the conjunctiva can still get the virus into your body. And yes, you can get it through direct contact through your skin. So is the mask effective? I don't know. If I were traveling on a plane, I might wear one. I might just disinfect everything around me and look for people that are sick. The key is that you just want to avoid that direct contact, and you want to wash the surfaces that you're touching. I'm not going to recommend to my family members, oh, if you're traveling, you must have a mask on. But I will tell them it's something to consider. It isn't a recommendation, again, of the CDC or even the airlines or anybody else. There's nobody who's saying, the mask is going to definitely prevent this. It's not. Coronavirus is going to be everywhere soon. It kind of has been everywhere, but this is a new version of the coronavirus. When I was in medical school and we learned about coronavirus, we didn't think of it as something that's deadly. However, the truth is that coronavirus has always been deadly. It is something that has been around. It just hasn't been around this way. So what should you do now? Hand sanitizer, wash hands, avoid contact with surfaces in places where there's lots of public use. The table at McDonald's, any kind of bathroom stalls. You want to avoid contact with those things, and you want to disinfect them if you can. I carry a spray, I carry a hand sanitizer. Those are things that I think really make a difference. So practically speaking, is there anything to do? Yeah, be aware. Understand that this is something new and that it does have a lethality to it that's very real. And it's not something to be poo-pooed. However, it's not the end of the world. I think that over the next few months that vaccines and treatments are going to arise very rapidly. just because this is such a hot button topic and the potential is there for a lot of cost to the health system if we don't find ways to control it and prevent it. So coronavirus is here. I believe it'll be here to stay. And I believe that we are on the front of this and that over time it will go the way of SARS and other bird flu and things that have come and caused problems and then have been handled and taken care of. Those things aren't gone, by the way. They're still here and they're still something that you have to be concerned about. But right now, you're going to hear a lot about coronavirus. I hope this answers all of your questions. Those of you who have been sending me texts and messages. And if you have other questions about it, I would refer you to the CDC because I am not an expert once again. I want you to definitely understand these are just my practical ideas as a physician being asked what am I doing. But the truth is I read what the CDC recommends, I read what the State Department recommends, and I always think it through a little bit further. I think just a little bit further beyond to understand what I need to do for my family and my friends and my patients and those around me who really depend on me to make the best choices possible for them. So this is Dr. Jay Calvert, and I really appreciate you taking the time to listen, and I hope this has been very helpful.